Hello everyone, my name is Connor,
And I'm Sulin.
and we put together a presentation on health literacy. So the organization that we're from is McLit, or also known as the Marathon County Literacy Council. And a little bit about it is it was founded in 1997 and reestablished here in Wausau June of 2017. And their vision is to provide free educational information and resources through literacy programs that include teaching, mentoring, tutoring, and coaching. And their mission is to improve the quality of life through literacy.
At McLit, we will meet you where you're at with whatever needs you have and or refer you to community resource that can. McLit has many programs and services for their clients, some of which include a computer lab, and that's for you to help learn computer literacy, and that's just learning how to type on a keyboard or how to navigate on the computer. There's also English and Spanish language learning programs. They can provide assistance with applying for your citizenship or your commercial driver's license or just driver's license. They also have adult basic education, and I will be teaching you English, reading, and math. They can also help you apply for your GED and your HSED. They have health and financial literacy programs, and finally, they can help you find employment and housing opportunities.
So a little bit about this presentation contains is we're going to talk about what health insurance is and how you can get health insurance. We'll also talk about how to establish a healthcare provider, how to make an appointment, the different levels of healthcare when you can't make an appointment. We'll go through vaccinations, why they're important, and some recommended vaccinations for adults. We'll also talk about the importance of dental care and where you can find low-cost dental care here in the Wausau area. We'll also go over some busing information and bus routes through Wausau. And then we also compiled a list of additional resources that are here in Wausau to help the underserved population.
So first off, what is health insurance? Health insurance is an agreement between you and your health insurance company, where in exchange for you paying monthly bills to them, they will cover some or all of your healthcare costs. And so when you're looking for insurance, there are some terms that you should know. One of them is a premium, which is just the word for the payments that you're making to the company. And then there's a deductible, which is how much you have to pay before the company starts covering your costs. And there's also coinsurance, which is the percentage of the cost that you will pay after you've reached your deductible. And then there's also copay, which is how much you have to pay for your healthcare provider. And then the max out-of-pocket, which is just the total amount of money that you'll be expected to pay in a given year for your health plan insurance. Here we have a few examples of different types of healthcare that you can get, or health insurance you can get in Wisconsin. The first one is Badgecare Plus, and this is for people who are low income or don't have any income. The next one is the Marketplace, and this is for people who are no longer eligible for Medicaid or CHIP, and CHIP is just insurance for children. There's also Medicaid SSI, and this is eligible for people who are getting the supplemental security income. Some other examples we have is Medicare, and this is for people who are 65 years and older, have end-stage kidney disease, or have Social Security disability. And the last one on this list is the Katie Beckett program. This is more for children who have very serious health needs or disabilities. And if you'd like to know more about any of these or about what other health insurance there is, you can always dial number 211 and you'll be connected with an expert. And as you apply for insurance, there are some steps that you should take. The first one is to talk to a guide. And this could be a health insurance navigator, and that's an individual or an organization that you can talk with, and they can help you find which health insurance companies and plans would fit best with you. Otherwise, you can just talk to people in your community, and that could be your friends, your colleagues, family members. Just talk to them, see how they got their insurance and if their insurance would work for you as well. The next step is to know your information. You should know your Social Security number as well as your family's, And then you should also know how much money you make in a year. If you need help locating this information or just help in general, you can always dial the number 211. The next step is to determine your needs. Your health insurance company will have different plans that you can choose from. So it'll make it easier for you to choose ones that are based on what you need covered. For example, if you have vision problems, you'd most likely want to choose a plan that covers any vision surgery or vision screening so that you can cover all your costs for it. The next step is insurance. Just make sure that your insurance is accepted by your clinic or doctor. It's very important because if it's not, you're going to be facing a lot of difficulties paying your bills. And then the last step is to just sign up for your plan and then pay monthly in order to keep it.
So the next topic we're going to go into here is how to establish the correct provider and some things to think about while you're doing it. So the first thing you want to do is you're going to find someone who's going to treat your needs. And by what I mean by this is you should seek comfort, trust, and good communication with your provider. The second thing you want to look for is find a provider that's going to work with your insurance. Look for areas that your insurance covers, and if you don't have insurance, call that provider and he'll point you in the right direction on to where to get served. The third thing you want to look for is to make sure you know the location of that provider. You don't want to find a good provider that's going to support your needs, but then you can't make your appointments because you have no means of transportation there. And the last thing you kind of look for is to know the provider's availability. Some questions to think about while you're doing this is know what their hours are and if they work with yours, and also if they have emergency calls. So after you find your correct provider, you're going to want to call that provider's office. You're going to want to have the receptionist transfer you to the provider if available or the nurse on duty. You want to schedule the meeting with that provider, and then you're going to want to sit down and kind of think about what we went over on the last slide. Make sure you can trust them, you have good communication with them, and you can feel comfortable with them.
So when you want to book an appointment, you can either book it online or you can call the clinic or hospital. And to find any of these clinics or hospitals, you can always do a Google search or Google Maps. Otherwise, we also have provided a few locations you can go to in the Wausau area at the end of this presentation. And then next, give your provider's name as well as your reason for seeing them. They may also request for additional personal information, and that could be about birth date, your address, or your health insurance. And again, make sure that they accept your health insurance. And next, select the best date and time that works for you. And if you need to reschedule or cancel your appointment, do so at least 24 hours before the date that you previously selected. As you prepare for your appointment, you can ask a friend or family member to come with you. They will be helpful in helping to remind you about things that the doctor may have told you that you forgot about. And if English is not your main language, you can always request for a translator. Make sure you bring questions about your health and any questions about your medications, and try to provide your pharmacy address. And if you don't have one, that's okay. You can always ask your doctor about which ones are closest to you or which ones are more affordable for you. Ask a doctor or nurse to repeat any information if necessary. And if it works better for you, you can ask them to write it down. And that way you have a hard copy to always refer back to. Arrive at least 15 minutes early to your appointment. That gives you and your doctor enough time to fill out any paperwork that may be needed. And then make sure you bring your photo ID, your insurance card, as well as any referrals. After the appointment, you can expect to receive an after-visit summary. And this would have your vitals, and that would just be your heart rate, your blood pressure. It'll also have any medications or prescriptions the doctor has given you, and also have steps to your future care. Make sure you check up for any follow-up appointments and schedule them before you leave the hospital or clinic. And if you have any questions or if you experience any health problems, such as finding that your symptoms are getting worse or you're experiencing really bad side effects from your medications, you can always call your hospital or clinic.
Yeah, so a really good question to ask yourself is, what if you're unavailable to make an appointment? And there's really three main levels of the healthcare system that kind of addresses this question. The first being the walk-in clinic, and what the walk-in clinic will do will offer you same-day care for minor illnesses and healthcare needs. The second level is urgent care. This is when your symptoms are a little more severe. They'll get you into a provider more rapidly than the walk-in clinic would. And then the last level is the emergency room, and this is when your symptoms are at life risk. So they have staff on hand 24/7 that are going to be able to take care of any emergency needs that you might have. So how do you know when to go into these different levels of healthcare? Well, for the walk-in clinic, you're going to want for symptoms you're going to want to look for are eye redness, headache, rash without fever, mild like flu symptoms, ear pain, and painful urination. You can even go in for a physical at the walk-in clinic. Say you have a job interview and they require a physical, but you never made an appointment for one. You can go in and walk in for that. Urgent care symptoms to look out for are going to be shortness of breath, persistent diarrhea, sprains and strains, small cuts, stomach pain, and dehydration. And then symptoms when your life is at risk and you need to go to the emergency room are going to be slurred speech or sudden change in your mental state, chest pain with difficulty breathing, weakness and numbness on one side of your body, severe cold and flu symptoms, serious burns and cuts, and broken bones and dislocated joints are all symptoms to go to the emergency room.
When you're thinking about your health, you should also think about getting vaccinated. And what a vaccine does is it introduces a dead or almost dead bacteria into your body, and your body will recognize it and fight it off. So once it actually come into the live bacteria, you will not get any illness from it, or else you might just get a very mild case of it. And so vaccines also help prevent the disease from spreading to others. And we have a list of different vaccinations for adults that they can get. The first one is HPV, and this is a sexually transmitted infection. And we have vaccination for that. And there's meningitis, and this vaccination will protect you against your brain swelling. There's also tetanus, which causes muscle weakness, and then TD, which stands for tetanus diphtheria. And if you get this disease, you would also get whooping cough. So it's important to get the vaccine for that. And then lastly, the two, COVID-19 and flu, they're really important vaccines, and you should consider getting those. If you'd like to know more information about these vaccines, other vaccines, or where you can even get vaccines, you can contact the Marathon County Health Department, and we have their address, phone number, as well as their website.
So something that's really overlooked in the healthcare field is dental care. And it's really hard to receive dental care because dental insurance and health insurance are completely different things. The importance of dental care is the mouth is full of bacteria, and the mouth being kind of the opening gate to the whole entire body, that bacteria can spread, and it can cause conditions like heart disease, dementia, throat and lung infections, mouth disease, diabetes, and even cancer. And here on the left slide, we have a picture of what the mouth disease looks like. And then the other photo is showing kind of the progression of gums disease. So how do you practice good dental care? First, you're going to want to brush your teeth at least twice a day in a circular motion. Look for toothpaste that contains the mineral fluoride. Fluoride is going to protect your teeth from decay. You want to maintain a healthy diet and limit sugars. Schedule a cleaning at least twice a year. You want to floss daily, and the most important thing you can do is either avoid tobacco use or at least try and limit it. So, great question is, where can you receive low-cost dental care? And the answer to that is the Bridge Community Health Clinic. They have a sliding fee discount policy, so they're gonna serve you regardless of your ability to pay, even if you have dental insurance, or it's gonna cut your costs down by a lot.
If you'd like to go to any of these places that we've talked about today, you can always use the Wausau bus transit system, which is called Metro Ride. And we're just going to give a general overview of it. If you'd like to know more information, we have the contact info on the slide. And so the Metro Ride runs from Monday to Friday, 6:30 in the morning to 6:30 in the evening. However, it does not run on Saturdays and Sundays, as well as the following holidays we have listed here. And if you find that you rely quite often on this bus transit system, you should consider applying for the monthly bus pass, and that's only about $42, but it allows you to ride the bus as many times as you'd want in that 1 month. And then if you have a Medicare card, you can apply for the reduced fare card on the website, and that will just enable you to pay the bus tickets for a less price. And if you want to ride the bus, here are some steps that you can take. First of all, try to plan your trip. There are bus routes and maps that are color coded, so it's easy to see where the buses will be going to and what bus stops there are. If you want to catch a bus, you can just find one of the blue bus stop signs, wait by it, and once you see the bus coming towards you, you can just wave to them or give a little signal that you want to board. And then as you board, that is when you pay. It is $1.75 for each ticket. Otherwise, you can pay $11 to get 10 tokens. And these tokens just tell you how many rides you can get. Children who are 5 years of age and younger can ride for free. And if you want to pay in cash, you have to remember that the bus drivers do not give any change back. Once you're on the bus, take your seat quickly. Otherwise, you can ask for the bus driver to wait until you get your seat before they start driving again. And if you want to get off, just pull on the cord alongside or by the windows. Now signal to the bus driver that your destination is coming up. And do this at least a block away before your destination. Here we have a map of the different bus routes. This is the English version. There's also a Hmong and Spanish version available on their website. So you can see the different color-coded routes and how far they go in the Wausau area. And here we have compiled a list of different organizations and locations that will be additional resources if you're interested. And if you see some stars next to any of the organizations, that just means that it's at the Community Partners Campus, or the CPC, that's located on Grand Ave. And we're just going to give a brief overview of their services and programs. And so the first one that we start with is the Wausau Free Clinic. This is at the CPC, and they primarily serve patients who are low income or have no income, and they also usually do not have any insurance. So the Wausau Free Clinic provides free lab testing, physicals, checkups. They also have free medications, so it's a great place to go if you are low income or have no income. There's also the Bridge Community Health Clinic that we mentioned just earlier. They also provide services to their patients, and they don't have to have insurance, but depending on how much they can pay for the fees, there's that sliding fee discount program where if they can't pay the total amount, then they can just pay at a lower rate. Next, we have the Marshfield Clinic Wausau Center. They provide treatment and care for any medical problems you may have. And there's also the Aspirus Wausau Hospital. Similar services and programs, and they are located all throughout Wausau. And then lastly, there's the Marathon County Health Department. They provide breastfeeding help, they help with children's health, they provide free shots as well as hearing and vision aid. The next list of organizations we have is concerned with mental health. So the first one here is the North Central Healthcare. They focus on mental health, addiction, and substance abuse. They also have adult protective services and different types of therapy that you can go into. And then there's also the NAMI Northwoods. This organization has peer support groups as well as mental health services and treatment for all ages and backgrounds. The next one is Stable Hands Equine Therapy Center. They provide a very unique way of providing therapy where you get to engage in activities with horses, and some of them would be reading to the horse. If you're a veteran, just interacting with the horse would be very helpful. There's also therapeutic riding and many more interactions you can have with these horses. There's also the Gospel TLC, which is a faith-based life-transforming program. They have two programs, one that's a 3-month program and another one that's a 12 to 18-month program. And they primarily try to serve individuals who have a past history of any drug use and incarceration or being time spent in jail. They also help these individuals find housing and employment opportunities. If you'd like to know more about mental health resources in the Wausau area, the third bullet point on this slide has a longer list of different organizations. The next one is food security. And food security is the ability for people to have access to fresh and healthy foods. So the first one is the Wausau area mobile meals. They primarily serve the elderly or disabled, and they give out meals for them at a very small cost. There's also the neighbor's place and the baby's place, and the baby's place is founded by the neighbor's place. So together they both provide feminine products, baby products, and that would be diapers and baby formula. There's also fresh, healthy foods that they provide and pet food. You can get all these twice a month at no cost. And the last one is a Blessings in a Backpack. This organization packs food for children to take home over the weekend, especially when they will not have enough food to eat at home.
So the next couple slides are just kind of the list of all the local pharmacies here around Wausau. Here we have their contact information and also the address. But it's also important to know that your provider will send you to the lowest costing pharmacy for your medication. And then here's just another one too, a couple more. So the next additional resources that we compiled were aimed at family support and housing. So the first one is the Marathon County Social Services. They offer different programs and resources to help support families. Programs that they offer are the Affordable Care Act, which is just health insurance. They have a bunch of child care support programs, and they also offer economic support as well. Another one is the North Central Community Action Program. Offer programs and services for low-income families to increase overall better living. And programs they do is they help you find housing. They do weatherization for homes. This just makes sure that your home is up to date to keep the weather out. And they also have a nice program called AmeriCorps, and this is just going to help you find work and teach you valuable working skills to help you find a job. The last one is Catholic Charities. They provide programs such as a warming shelter. They also have staff available to help with adoption programs, pregnancy support, and they also outreach with other programs. So if they don't have what you need, they can point you in the right direction. The next resources that we compiled were aimed at community focused. So this is so the first one we're going to talk about is the Salvation Army. Programs they do is overcome poverty, and what they do is they're going to get you in touch with a person who's an expert in this, and they're going to they're going to form you a budget off the income that your family makes. They also provide housing and meals. They have a program called Brighten the Holidays. So if you have nowhere else to go for the holidays, they have food and gifts and stuff like that, just to make sure you're not alone on holidays. They do programs on addiction, and they also want to share God's love. So I know they offer Sunday school and other kind of church program get-togethers. The next one is the Hmong American Center, and they have 17 different programs aiming to engage the community in economic, social, and multicultural development. And the last one is the Open Door, and their kind of mission statement is to provide educational services to meet short and long-term needs of individuals who are incarcerated and who have been released from jail. And the last resources that we put together were veteran-focused here around Wausau. So the first one is the Marathon County Veteran Services, and they're going to provide help in preparing claims and applications for veteran benefits, such as information on VA health benefits, VA insurance, education benefits, burial and death benefits, and state veteran benefits. So their whole main focus is just to make sure that the veterans are qualifying for the benefits that they deserve. Another really neat one that's around here in Wausau is the Wausau VA clinic, and they're going to provide primary care, but also provide special health care such as skin care, addiction programs, mental health, and they even have their own pharmacy service. Another one that's around here is the Montgomery Plant Dudley Post 10, and that's a volunteer veteran group that provides assistance to local women veterans, including limited financial aid for gas, rent, minor home repairs, and moral support. And the last one is the Homeless Veteran Hotline. If you're homeless, a homeless veteran or on the verge of becoming homeless, you're going to want to call that number on the bottom of the slide here, and they're going to get you the help you need and get you figured out. And that ends our presentation. Thank you very much for listening.
Thank you very much.